Welcome, fellow physicians. This is Dr. Eppes reporting from the General Assembly on January 22nd. We are now 1 week into the legislative session. Your lobbying team is here working hard to impact the laws that are being written, and especially the healthcare laws for the state of Virginia, as we try to keep Virginia the best place to practice medicine. We have just finished having our second White Coats on Call Day. I encourage each of you to come here and be a participant. It means a lot to the legislators for you to make the effort to come here and talk to them. They understand what a huge effort and time and cost to you that it takes to come down here, but it's very important to build that individual relationship with your legislator and to keep that going not only during the assembly session but also out of session. We've talked a lot about the malpractice of CAP issues, but I want to talk about an equally important issue, actually two issues that are wound together. The first is smoke-free air, and then its relationship to Medicaid funding. Of course, we all physicians should be for smoke-free air. It's the public health and safety thing to do for our patients, no matter what age or sex that they may be. It is wound even tighter this year to Medicaid funding because the hard-fought gains that we have for the last 3 years through the Assembly could be lost because Medicaid funding is on the chopping block. The governor has proposed a increased tax on cigarettes to make up the difference so that Medicare funding, especially physician reimbursement, wouldn't change. And that alone is a reason for supporting the governor's initiative. But again, I remind you, smoke-free air is an issue that we should always stand for. I encourage each of you to continue to be a part of the Medical Society's efforts here at the legislature. I encourage you to click on to the grassroots section of our website so that you might make the proper connections, and as we work hard to make Virginia the best place to practice medicine.